Welcome to today's webinar entitled Getting the Best from Immunotherapy, Solve the Scenarios. I'm your host, Krista Rubin. You know me by now, and I'm here with a very special guest, Ms. Kathy Madden. Kathy is a nurse practitioner at NYU Perlmutter Cancer Center, and her practice specialty is similar to mine. She also specializes in non-melanoma skin cancers and melanoma skin cancers. And she has extensive experience in managing patients on immunotherapy. So I'm thrilled to have you here today, Kathy. I'm looking forward to our discussion, and I hope you can bring some insight and teach me as you always do. So welcome.
Thank you so much, Krista, and thank you to AIM for having me. It's such a pleasure as always.
So I'm hoping you and I today can talk a little bit about best practices, what we do, how you manage or talk, educate people, empower them to be successful when receiving therapies like immune therapies, which, as you know, have just revolutionized the treatment for patients with non-melanoma skin cancers like Merkel cell carcinoma, squamous cell carcinoma, and advanced basal cell carcinoma. It's been incredibly exciting to have these therapies available for a certain subset of patients. But as you know, they come with a unique toxicity profile. They're a family of medications that work in a different way, very different from traditional cancer therapies. So what I hope to hear from you, or what I'd love to talk about now, is what are the how do you prepare patients for receiving these therapies? Like take me through a typical day when you're seeing patients and maybe somebody's starting on immune therapy. Just walk me through what your experience is like.
Sure. Thanks, Krista. You know, coming from the advanced practice provider vantage point, nurse practitioners, physician's assistants, and Krista, you and I are both NPs, and we very much so make these decisions as a team when we approach the patient at a decision-making time in clinic for either a treatment change or a brand new treatment. So we collectively decide what the best approaches are going to be for the patient and how that conversation is going to be sculpted. And oftentimes in my clinic, the physician is really the lead. The oncologist is the one who's sitting down with the patient at that time point and saying, okay, you know, here reviewing all of the technicalities, whether it's pathology, whether it's imaging studies, a collection of all of those things, and then saying, okay, here's the next step. And when systemic treatment is the next step, the physician will oftentimes take the lead with starting out introducing the concept of immunotherapy and talking about the side effects and discussing what some of those details might look like and informing the patient when they need to give us a call. And so it's the first time that they're hearing it. And with education, having that repetition is really important. So in our clinic, we have a workflow where when the patient, after they've signed consent or they think about what treatment, if they're presented with multiple options, they'll make a choice and then they return to clinic. And we usually seize that opportunity when they're back and they've made this decision. They know that they're moving forward and their readiness to hear a little bit more information is more on point at that time. And that's usually where the nurses or the NP, the PA are coming in and saying, I'm going to come in and assess where your knowledge is and get that level of understanding. What did you retain from that initial conversation with the
Because
physician?
it's overwhelming. It's completely overwhelming for many patients when they're first hearing this. They're often still reeling from the diagnosis and the fact that they are going to require, or it's being recommended, systemic or whole body therapy. And so sometimes don't you feel, sometimes I describe myself as the sweep team. We kind of go in and sweep up. I don't want to say the mess, but it's often patients just are overwhelmed. And so I feel like sometimes it's our job to say, okay, let's take a step back, take a deep breath, And let's kind of start again. So I love how you mentioned that you feel like the docs kind of introduce the concept and then we kind of step in and fill in those blanks. I mean, sounds like our practices are similar in that
They
way.
are, well, we know each other a long time, and we've actually grown up with these medications. And so with that comes a responsibility with this knowledge to educate not only our patients, but all of our upcoming and newer providers, whether they're physician or clinical practitioners. But we're talking about patients and families here in this setting, and we have a lot of experience with that. And we've seen the best of the best, and we've seen some of the challenging of the most challenging. So really, as you said, I really like how you said, we're kind of the sweep team. We're coming in and we're tidying up. Where is there information that might be, there's gaps? Where do we need to fill in some of that information to seal some of those gaps? And doing a check-in, getting that understanding. What did you remember hearing from that visit with your physician? Or, what of your own independent information studies? Have you looked at anything? And then also kind of assessing what the patient's style and how they like to receive information. And I'll literally say that, like, okay, so how do you like to receive your information? Do you like sort of to hear things in a bit of a larger sweeping general information, or do you like some of the more granular nitty-gritty details? And or somewhere in between. And so sometimes patients have to think about it, and sometimes they're right on point with it. And it's really important to keep in mind, and that I've found is that sometimes the care partner, the family member, the support person or persons with the patient may receive their information differently. So there may be the patient who says, I just like just the general information, like give me like what I absolutely need to know. And then that care support person may say, oh my gosh, I need every single detail and all the statistics and blah, 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 blah. And it really does play into some of their roles in how and who they are with one another outside of the clinic setting. So we really try to take a very proactive approach that's required on both the provider side and the patient side. So that education, not only of the patient, but the caregivers as well. So I know the next step I would do is, once I've assessed what their understanding is, how they like to get their information, what they know, and now I know where to fill things in. But I really, really like to focus in on the mechanism of action of the agent that the patient has decided and the team has decided to move forward with.
And that's so important with these immune checkpoint inhibitors because they have a unique mechanism of action. And I think if there was ever a time that education is absolutely critical, it's with these agents because they have a unique side effect profile. And it really is important for not only, as you mentioned, the patient, but the caregiver, because a lot, cancer is, I'd like to talk about a little bit later, but cancer is a disease that affects the entire patient and family, or and however they define it. But let me just get back to the mechanism of action. I'd love to talk a little bit more about how you prepare patients for understanding and what to expect in terms of treatment and toxicity. So walk me through that a little bit. Let's say I'm a new patient into your clinic and I'm going to be starting on an immunotherapy, an immune checkpoint inhibitor. What do I need to know?
So I start off with the mechanism of action, introducing them to that so they can understand how the drug actually works. Because once you have an understanding and grasping the concept of that, this is not cytotoxic chemotherapy, that it's not traditional cancer therapy that you might have heard about throughout one's lifetime. And a lot of these patients are a little bit older. We're generally dealing with adult populations. So they have some rich experiences through life and maybe with other family members or even themselves with prior cancer histories. But we talk about the mechanism of action because once they understand how the drug actually works, then they have better understanding about why we see the particular side effects that we see, which all tend to be inflammatory in nature. That's a very broad generalization, but we can see suppression of some systems, and we can see amplification or overactivity of other systems. And so the toxicity profile is more unique, and there can be side effects of not just one particular organ system, but there can be several organ systems impacted at the same time. Usually there's one that leads, and if someone comes in and has already reviewed information, they might come in feeling really overwhelmed, saying, oh my gosh, look at all these side effects. And that can be very daunting, and that can also really play into the decision making. So a lot of times the exact phrase that I'll use is, listen, that information is really necessary to make sure that you're aware of all of these possibilities, but that information is also very two-dimensional. You're reading a paper, allow me to make it a little bit more dynamic for you, and let me suss it out so you can better understand it. And one of the things that I next talk about after reviewing all of the possible side effects, or like the top ones that are most common with that particular agent, most of them have a lot of overlap, and then also focusing on some of the outliers which could be problematic, and making sure that people leave with information, refining some of their questions that they might have about specific side effects. But then I also like to move into telling them about when the side effects start and what that intensity looks like, because we share all this information and everyone goes, oh gosh, all of this is just going to happen like all at once. When do I expect this? It's going to be like really bad.
Yeah, what am I doing? What am I doing?
Right. And, then we talk about grading, and grading, we coined that little phrase, grading guides the management. So grading means that we assign a level. We don't assign it. The CTCA guidelines, which is the cancer terminology, adverse events, this government-based organization is great because it provides us with a communication tool across speaking through clinicians, and I introduce patients to it so they understand that grades 1 and 2 are like really mild and maybe even moving into moderate, and then grades 3 and 4 are more intense. They're more serious. They could be more severe or really
It's a guide. It's a guide to help us. Yeah.
And that a lot of times the side effects start off as like grades 1 and 2, and that they stay there. So it puts it into context, all of this information.
And those grading, just so our audience is clear, that grading is necessary so that we can all speak the same language. Like if I say a patient has a grade 1, which is the least side effect, you know exactly what I mean, even though we're at different institutions. So it's a way to speak the same language. And what I like to say, it's a way to make something very subjective, objective. In other words, your definition of mild, you have a mild rash. Well, to me, that could be a very scary rash, but you don't think anything of it. So we all have these different definitions, and that's incredibly important that patients hear too. We need ways to really be able to hone in on how severe we think a problem is, and what are we going to do about it? So I'm sorry, I didn't mean to interrupt you, but I just think that context
absolutely
is helpful.
You're an amazing grader when it comes to, and I know an educator when it comes to grading. So I really appreciate that infusion of information there for sure. So once people understand that the side effects don't usually come right on really strong, they usually start very subtle, and that really does weave in a common theme throughout all of the education process, which is call us at the onset, at the very beginning of a change.
Keyword change. Because with these medications, and I think it's important to know that for patients to know that side effects are not a guarantee. Not everybody has side effects. So when we are preparing patients and their families for kind of what to expect during the treatment, there's an if. If side effects happen, here's what we want you to be prepared for. But they're not a guarantee. And most people tolerate these medications quite well. There's always the exception to the rule, and nothing scarier than a Friday or Saturday night, you're home and you have a side effect and you're panicking. At least if you've heard this information before, and perhaps you have some written information in front of you that was provided, it's less scary. And it kind of sets that expectation of, oh, I remember Kathy telling me that I could have this happen at this point in time. It makes a very scary scenario much more controllable. And when patients are educated or aware, it's very less scary. They're empowered to know what exactly they can expect to happen. So again, I digress. I didn't mean to interrupt you.
No,
I like what you were
absolutely.
saying. And I like how you keep bringing in caregivers, because it's incredibly important that they are a part of this. And caregivers defined however the patient defines them, and whoever they define as a caregiver. It could be a friend, a family member, a neighbor. But it's
And they
important to
can
have
be,
somebody.
yeah, they can be a much more objective observer because listen, we're all human, and as much education as we have, if we're going through a personal issue that's healthcare related, sometimes you lose a little bit of your objectivity. I think it's the rare person who just remains incredibly practical through it, and that's human. And so we understand that, and that's why we really impress upon the point that this is a collective journey. The patients are not expected to navigate this all by themselves. But Krista, one of the things to your point is that I wanted to dovetail on is that the information is provided for patients to get comfortable with what could happen, what could come up. So it helps decrease some of that surprise element that can come along with the unknown and the uncertainty. And that if you don't have side effects, it's not a bad thing. Not everybody gets side effects, and some people get them way later at the end of treatment or after treatment even. So just knowing that you don't have to do this by yourself, and also being communicative to the people who surround you, who were there to support you, and being honest with them, because they're there as also sounding boards to try to say, and what I wanted to dovetail was, just because I review side effects with you doesn't mean that they're normal to have. So just because Kathy, Krista, or your said provider said, you could get a rash, you could get really bad itching, you could get very, very tired. Just because that's presented there doesn't mean that it's normal to have to suffer with it. So it is important that we know about it at the onset so we can do a proper clinical assessment, weigh in, and that we can help navigate what the next time point is to connect. And also, do we need to provide an intervention at this level? And it just we can really sort of handcraft the conversation.